Social emotional support is essential for young people who are consistently impacted by adversity. This work can't be done by one person or in one place. It takes a village and a holistic approach. I am Raymond Omar Long, your emotional support systems advocate and strategist. Today on the show, we're going to explore how creating supportive environments everywhere young people live, learn, and play gives them a much-needed green light to be great. Today, we are joined by a double board certified psychiatrist in general and child and adolescent psychiatry. Dr. Brandi Yarberry obtained her medical degree from Ohio University and completed her residency and fellowship training at the University of Arkansas for Medical Sciences. She's a trusted voice for young people, a champion for families, and in my opinion, one of Arkansas's best kept secrets. Let's have a great conversation.
Well, listen, let's get to it. Dr. Yarberry, talk to us about how you define holistic care. Let's talk about it professionally, and then personally.
Okay. Professionally, holistic care is, as you mentioned earlier, looking at the whole child. Looking at not just a symptom, which is usually what parents, reach out to me for. Their kid is having anger or they're having anxiety or
Right.
they're struggling with behaviors, but
Right.
looking beyond that, looking at the whole child. So it's taking a step back,
So again,
right?
okay.
Looking at what's deeper, looking at them mentally, emotionally, you're looking at them spiritually, physically, looking at their environment,
Yes.
looking at their experiences, looking at them again holistically to understand where they're coming from, understand their challenges, their deficits. And then once you know all that information, then you can start doing the work. Then you can start helping them heal.
Then you can start doing the work.
But
Then you can
that's
start helping them heal.
yes.
That's key. That's key. There's not a lot of people who really understand that, or they understand the essence of it. But I think there's a gap in the reality of what that really takes and how much we all need to really surround ourselves. And we talk about creating a village, but it takes a village for mental health support as well. And so, what would you say to the audience about the importance of everybody in a child's village to view that child's mental health as their concern?
It is. No child lives in isolation. Everything that an adult does and says, how they interact with their child, it all influences their child. It influences how they study, how they perform at school, how they build future friendships and relationships, how they relate to the world. Everything that adult does impacts their child and their mental health and their future. So it's everybody's responsibility.
Yeah, I like it. Tell us more about your firm, right? You focus on holistic care.
Mm-hmm.
And so you have a pulse on what the young people are facing today.
Mm-hmm.
So give us a little bit about the focused work of your firm, your practice. Tell us all about it. Shameless plug. Please promote your business on the show. But then follow up with, from your point of view, what are our youth facing today? What are those emotional and social challenges that school districts, school building leaders, and parents need to be worried about?
As far as in my practice, I take pride in, again, incorporating the village, the child, which is very important in the child's care. So engaging the child, the parent, the family, that may include grandparents, aunts and uncles,
Yes.
as well as collaborating with the therapists, collaborating with the schools, collaborating with the school coaches, whoever is in that child's village, and getting all the information I can from all of these people, not just talking with the parents in that one session and making decisions based on that. But again, stepping out into that child's world. When you do this, also, you get to learn about what struggles they're having at school, what struggles they're having at home. So I hear a lot about these things. I think one of the biggest concerns I have is bullying. I hear this more often than I would like to hear, in person, with peer interactions at school, with sports, but also online. That is probably right now one of the biggest concerns.
Online bullying. Elaborate on what you mean by bullying, right? The picture that we all have of bullying, right, is a child being put into a trash can, right? Or name calling or like physical abuse. Help us understand the full spectrum of bullying.
I was just about to say that.
Yeah.
Like anything else, there's a spectrum.
Yeah. No, you're okay. You're okay.
Um, and it's not necessarily the textbook thing that you see. It could be the extremes. It could be physical bullying, a kid shoving another child. It could be, a kid name calling a child. But it also can be the things that are not said. I think that leaving a child out, isolating that child, whether that's from another student, it could be from a teacher. I've seen it happen from school staff too that don't understand that child and where that child is coming from.
Right.
But definitely, again, it's physical bullying, it's emotional bullying, it's mental bullying too. Some words can hurt as much as physical contact can when it comes to abuse.
Yeah. So is it fair to say that anything that really interferes with a child's sense of belonging or feeling accepted in an environment can point toward a form of bullying?
It
Yeah.
can.
How would you describe that? Okay.
Yes, it can. One of the first stages in development, when you have an infant,
Mm-hmm.
is developing a healthy relationship with the caregiver. That doesn't stop. That goes on through the child's whole life. The connections that they make with other same age peers, with adults in their lives as well. It's crucial. It's very crucial to their development. And when they don't have that connectedness. When they don't build those healthy relationships, it can leave them vulnerable and leave them in a place where they become depressed or they become anxious. And with that, they have a harder time dealing with what's going on around them.
Okay. So let's talk about adverse childhood experiences. The CDC defines this as experiencing violence, abuse, or neglect. It's list witnessing violence in home or community, having a family member attempt or die by suicide, environmental household conditions that undermine stability and safety, household substance abuse problems, household mental health problems, instability due to parental separation or household members being incarcerated, homeless or unstable housing, food insecurity, or persistent economic hardship. And maybe our audience has heard of the adverse childhood experiences, but I wonder if they're aware of what this means for a young person, like while they're going through it, and what that looks like in adulthood. And as we focus on adverse childhood experiences, I'm going to shift our conversation at some point to talk about positive childhood experiences. Because I feel like the data shows that you can kind of combat some of the impact of adverse childhood experiences by creating positive childhood experiences, which is what the Green Light to Be Great is really about. That emotional support, creating those environments. And so adverse childhood experiences is prevalent almost everywhere, right? The data shows, national data, 2 in 5 U.S. children have experienced at least one. Roughly 1 in 7 have experienced 2 or more. And 1 in 20 have 4 or more. It's higher, right, as the child gets older. Adverse experiences, we know that it activates a stress response system so often that it begins to wire for survival instead of learning, confidence, and emotional regulation. This affects attention, decision-making, memory, and emotional stability. But then ACEs, they predict long-term emotional and mental health challenges, anxiety, depression, difficulty forming relationships, impulsive or withdrawing behavior. And so with what you know about positive childhood experiences, what's the science behind how these positive childhood experiences can combat some of the inevitable adverse experiences that our young people will face?
We know that, again, when they experience these ACEs, that it puts them in a vulnerable place emotionally, mentally, but biologically, we know that their stress hormones are higher. It sets them up. If there's not positive experiences in place, you can set them up for struggles in relationships in the future, difficulty holding a job, difficulty managing their money in the future, and other stressors in the future. But we know that there can be some reversing of that. So let's say we have a child who grew up in a home that was invalidating. Maybe the parents had their own trauma and they couldn't be emotionally available. Well, that makes it difficult for them to have healthy relationships themselves. It was never modeled to them. And they never experienced that with another person and within the home. But let's say they start therapy or they get in a healthy relationship with a coach or a teacher that can help model that for them. It can help teach them that. And they can become a blueprint for their future relationships. it can reverse it.
Yeah.
I've seen this happen.
You've seen it happen. You've
I've
seen it work.
seen this happen.
The blueprint for future relationships. I really like that verbiage. What do you mean by blueprint? Is it a standard blueprint? Is it a blueprint for each child? Is it the blueprint of just healthy interactions? Elaborate on blueprint for me.
What I mean by blueprint is, and it varies from person to person
Yes.
and relationship to relationship, but it shows them what a healthy relationship can be, what that looks like, what that sounds like, what that experience is, what it doesn't feel like. Being able to identify warnings in relationships, being able to identify what are positive attributes in a relationship. It helps them understand holistically, really, what a healthy relationship is, and be able to take that and relate that into other experiences they have with other people.
So we've talked about, from a large bird's eye view, what that holistic care looks like. So let's say if you were consulting with a school and a principal wanted to know, give me something practical. I understand what you want me to do, but how can we do this? How can we create a school environment where we're holistically informed and in a position where we can take action to help our young people emotionally?
It starts with education. There's not just an innate understanding of mental health, and there's a lot of stigma out there. So it starts with education, what mental health is and what is not, what behavior is and what is not.
Yeah.
And then, breaking the stigma. But I mean, people do the best with what they have, with the tools they grew up with, what they've been exposed to. So if you have a teacher or a staff member that has their own trauma, right? They have their own biases. They're going to have a hard time reaching a child, especially a child that may have some similar characteristics of what they dealt with as a child. There's so many dynamics that go on between people. So I think first, educating our staff. That means having a relationship between the schools and like mental health agencies. There's a lot of school-based programs. There's some resistance of some schools letting mental health providers into their schools. So I would say opening these relationships. Schools allow mental health providers to come in, educate their staff.
All right.
Have, in-services on it, where there's open communication about it. And I think exploring a relationship that a teacher could have with a student that can help support them, support their mental health. I think learning how to use language with children is really important, where it's not punitive and everything's not a punishment, but learning how to reframe things I think is important. Instead of, I use the name Sam. Sam, you keep doing this. Why do you keep doing this? Why are you having this behavior? Taking that child to the side and something maybe you learned in your in-service that, maybe, behavior is just a symptom. Behavior is like pain, belly pain. If you go to your primary care doctor, if you tell them you have belly pain,
Yes.
that's all they know. They have to do a workup.
Sure.
They have to ask more questions and try to understand.
Yeah.
Same thing with mental health. Behavior is just a symptom.
Yeah.
We have to try to figure out what's going on underneath it.
Right.
Most kids are good kids. They're doing the best they can with what they have.
Yeah.
When they have other things going on, they're distracted. They act out. Everything comes out as behavior. Depression, anxiety, bipolar, not sleeping at night the night before, stress. Everything comes out as behavior. So it's our jobs to really dig into that. So if teachers have that background information, they can look past, Sam is in class talking again, acting like a class clown. That's what I hear a lot. It's like, okay, what's going on behind that?
Yeah.
Go ahead.
Those obvious symptoms. No. That's good. I love how deep you're taking our conversation. And I just love the synergy between what the Green Light to Be Great is all about and your approach, your philosophy, right, as far as like supporting young people. And so there's two things I want to hone in on there. One is you talked about, I was just reading up on some research on how a lot of times depression, anxiety, mental illnesses, they manifest physically. And you talked about someone going to the medical doctor for a stomach ache, right? But maybe the medical doctor isn't really trying to make a connection on what's happening mentally. And so the symptoms are being treated. How prevalent is that in the lives of young people? Because people know adults, right? Headaches, stomach pains. But what's happening when young people have those same symptoms? It's I'm sure we're just providing Pepto-Bismol. how close should we be looking into, like, where are these symptoms, physical symptoms coming from?
I mean, I think with every child, this should be part of the conversation. Mental health is health. So when you check in on someone's well-being, these questions should be part of it. And it may not be as mental health. It may just be a stomach ache and need Pepto-Bismol, but you don't know till you ask those questions. So it
Yeah.
should always be part of it.
Yeah.
It is very often I've had kids that go into the ER for panic attacks.
Mm.
Normal workup, and it turns out that it wasn't a heart attack, there wasn't any serious pathology going on. It was anxiety. It was severe anxiety, but no one ever talked to that child about, are you having any worries?
Yeah.
What stresses are going on with you? The physical and the mental are connected. You cannot disconnect them.
I just had a thought about a family friend who's experiencing some, like, some of those chest issues, perfectly healthy. They have no idea what's happening. That's really interesting. Yeah, we missed the mark on that all the time, I think, as
We do.
society. And then, Dr. Yarberry, we talk about assessments. Clearly, right? You know how to assess. How can the everyday person assess? How can the teacher, right, assess? If we don't have, say, if we don't have access to you, what points towards something that we can solve, and versus let's go find Dr. Yarberry and help this young person out?
I think when you see a child struggling, you see a change in a child. Teachers, I mean, our kids spend more time with their teachers than they do at home. So teachers get to know our kids pretty well. And if they see a change in the child, I think that should trigger a conversation, especially if it's a persistent change. So if they're missing school a lot, if they are complaining of stomach aches or headaches and want to go to the nurse's office all the time, if they're falling asleep in class, they're suddenly starting to act out, withdrawing from their peers, sitting alone, things like that are triggers for a teacher to think, hey, you know what? Something's going on. And I think just having that conversation, asking, hey, how are things going?
Yeah. Okay. So another thing you brought up was the symptoms. This is when, this type of movement, it gets real personal for me, because we talked about adverse childhood experiences, and I experienced 5 or more, right, of those during my childhood, but I never had access to a mental health professional. And so as an adult, I've spent a lot of time dealing with kind of like the mental health downfall of that reality. And I've been fortunate, right? God has been good. I've been able to really get access to some great therapists, right, who have really allowed me to really manage and deal and learn and even heal from my past. But growing up, right, my mom was in a wheelchair. My dad dealt with drug addiction. He was incarcerated. I went to probably 8 different schools before I graduated high school. I dealt with some of the forms of bullying, but there were no signs. A couple of times I've acted out. There was a fight. I was bored, and so I hacked into our computer's security and pulled up pornography that I was curious about. And of course, I was reprimanded for all of those. And you have those tough conversations with your older successful cousins and uncles, but that was it. And that was only like 2 years. But all through school, I was just quiet, wasn't present, didn't really pay attention. And it was just like, oh, he's just a C student. That's just who he is. And so I don't know how to solve this problem, but there's lots of interventions, right, and help for students who are obvious, right? But what about the students like Raymond Omar, right, who you're just quiet, you're just dealing with things internally? How can we get to those young people? Maybe their behavior isn't changing. They knew me as a C student. It was just C's were C's. Being absent was absent. But no one ever dig deeper to find out why. It was like I was kind of like rolled off. It was just up to God, like what I became.
Couple of things that come to mind. And I think our pediatricians are doing a better job of this these days. But I think, when you go to your yearly appointments with your pediatrician or a family doctor, I think that should be part of the holistic assessments. You get your ears checked, you get your eyes checked, your heart checked. We're going to ask you those questions. So I think that's part of it. But I would love to see some form of that in the school, some kinds of screenings. Because, I have kiddos who struggle with anxiety and they're internalizers.
Yeah.
So they're perfectionists, they got straight A's, they, do what they're supposed to do, never ruffle any feathers. But on the inside, they're really struggling and no one knows until they say something. They don't want to disappoint anyone. They don't want to make their problems other people's problems. That's part of their anxiety.
Yeah.
So you can't ever assume what someone is going through or not going through. You have to ask those questions. So setting up some ways to do that, whether it's at a PCP office or some screenings they can do yearly with the kids at school. I would love to see that. Some kids will respond on a piece of paper to a question, even if they don't respond in person.
That's a really good point. It's allowing young people to communicate in ways that they're comfortable. I think about social media, right? I think about what can we learn from like watching what young people are doing and what they're singing and even what they're dancing to. A lot of times it's kind of judged, but it's a form of expression that we should probably pay more attention to.
It's
Yeah.
true. It's
Yeah.
true. The social media platform could have, and there are some moves in that direction to have a more positive impact on our youth. It definitely, we all know about the negative.
Right.
If we could make it safer, and I think that's the biggest word I would use. Make it a safer environment, a more positive environment. We could use it for good.
Yeah.
We could use it to help screen for some of these things and provide services and
Yeah.
access.
Yeah. Because there's a dilemma. We understand, schools, youth serving organizations, they are strapped for time and resources. So let's get creative with how we learn about young people. That's great, and that even wasn't a part of our conversation today. It just kind of came up organically. Those are some of the best solutions come that way. Now let's go deeper with assessments. Share with us what you can about your approach to assessments, right? The difference between a assessment with a therapist versus an assessment with a psychiatrist, and then also your unique value proposition with the assessment that you use to treat and make recommendations.
So it's a conversation like what we're doing now.
Yeah.
Meeting with the patient, building their rapport, and, first of all, just open answer question. What can I do to help? And you can get so much information just giving someone a chance to just talk. Just let you know what's going on in their lives, what their concerns are. And then after that, I get their information and I dig in from there. I have a structured interview that I do to make sure I'm getting all the information.
Yeah.
And including, their strengths, their weaknesses, their access and impact from social media. That's something I had to add in the last years. And looking at their community, who's in their community, how can we implement them into our treatment plan?
Yeah. There's also a negative stigma around assessments, right? It's the word is kind of like, ooh, my child, don't assess my child, don't assess my students, right? What would you say to the audience, right? Who has those concerns, right? It's kind of like the ignorance is bliss kind of attitude that we take into many things. Can't take it into a child's mental health. So how would you combat that stigma of don't get the assessment, right? Because you're kind of afraid of what you may find out.
Yeah. I think education is important. And I again try to normalize that mental health is health.
Okay.
It's
Mental health is
part of
health.
part of the whole child.
That's so good.
You can't
Mental health is health.
separate it. Yeah. You can't separate it. And I often have them then tell me what their challenges are with that child.
Yeah.
And as we talk about that, I ask, what are their solutions? What are they trying to do? And I'm like, how's that working?
Yeah.
So
Yeah.
kind of taking them through it. And then I think trying to explain what is a psychiatric assessment, because a lot of people just don't know.
Yeah.
They don't understand. They know you're going to go talk to a shrink. That's all they're thinking about. You're crazy.
Yeah,
They're crazy.
you're right.
And so I think normalizing it is important and letting them understand what the process is. That, after you see me, I likely will refer you to a therapist. This is what a therapist does. I may or may not use medications for you. That may not be what this child needs in their treatment plan. It will only be used if it's necessary.
Right.
If we do, going through the side effects of the medication. I think a lot of it is education and normalizing. If your child has a headache, your child has a tummy ache, you're going to take them to the pediatrician. you
Yeah.
know,
No hesitation.
we can help too. If your
Yeah.
child has anxiety or they're stressing or they're having a hard time sleeping or have a hard time academically in school, there's help for that. We can help with that.
Yeah. How can youth serving organizations reach parents, right? How important is the two-generation approach? Because I think sometimes, right, it's like our parents can't give us, right, what they didn't have, right? And I remember like sitting in my therapist's office, and my therapist would always ask me about my family and my mother and my father. And I think highly of my mother and my father. And the older I got, as I started to study psychology for myself, I started to develop more empathy for like their stories. My dad, his mom was schizophrenic. She forgot his name, 14 on up. My mother dealt with a disability from she was 4, right? Wheelchair bound, or never had any counseling for her, or never had any support. And so part of me like understood why I didn't get some of the things I may have wanted, or why some of the adverse childhood experiences were kind of like inevitable for me. But I would never say it. It was almost like it was either like I was almost angry at myself that I didn't overcome adversity as a young person and still have like this stellar background. So, I mean, how do we take that two-generational approach? Because parents, they're fighting for time and attention. And sometimes a school, a youth serving organization, a youth program at a church is the only way you get to that parent. And so what can they do to like just change this mindset around mental health and psychiatric assessments so that parents can be empowered to like take care of young people holistically?
I again, I'll talk about education a lot
Yeah.
because I feel like people just don't know. They know what their parents told them.
Mhm.
Parents know what the grandparents told them, and there's a lot of misinformation that I know in my family,
Right.
there's a lot of misinformation that's trickled down from generation to generation.
Okay.
And so I feel like, again, making a time and space where those organizations or those youth groups can talk with the parents. Give those parents that time too to answer questions, provide accurate information, let them know about resources, show that you care. Education and showing someone you care will take you very, very far.
What's education? I'm thinking of like group counseling came to mind for some reason. What's your opinion on it? Is it a more effective or efficient way of getting young people or their parents some type of therapy? Or
Sometimes it can be kind of a gateway into therapy
yeah.
for some people. They feel more comfortable. They're in the room with like-minded people who are
Right.
going through similar experiences. So for some people, it can be a step to get them into individual therapy or family therapy, whatever they need. I wouldn't say it's appropriate for every situation. It could be triggering for some people who've been through trauma, but in certain diagnoses and certain situations, it could definitely be beneficial. Getting everyone in the same room when you hear someone who's telling a story similar to yours, and you
Right.
can relate to
Yeah,
that.
the community.
That's powerful.
That community is powerful and key.
Powerful.
Yeah. All right, let's talk about medication. Scary, right? Scary hours. Medication, right? It from what I've learned, it fits into a broader wellness plan. Talk about how it should be managed and how it should be incorporated into the lives of young people dealing with various mental illnesses.
I would say it's not necessary for everyone and not for every diagnosis, not for everything.
Yeah.
So it won't be a part of everybody's treatment plan. It starts with a professional,
Mhm.
whether it's a therapist or psychiatrist, and having that comprehensive, like holistic evaluation.
Yeah.
We can figure out exactly what we're going on, exactly what we have going on. Just like when you go to your family doctor, they're
Yeah.
not going to jump in to give you medicine. No, let's figure out what's going on first. Let's do your diagnosis first and figure out what is appropriate for that individual. Everybody's mind is different. Everybody's body is different. You got to take into account genetics, right? The kid's physical health, lots of factors, other barriers too. So you have to really start with the evaluation, figure out what is appropriate for that particular child and that particular family. And if it is medication, then we have those discussions. We have
Yeah.
those discussions about what the options are,
Yeah.
all the side effects that could possibly happen. how the medication can help. So all the pros and all the cons. And, I tell parents, I don't push medication. It's my job to educate you, let you know what the options are, and make recommendations. But I put the power in the parent and the child's hand. And I want the child involved. If they're old enough to be involved in that discussion, I want them involved.
Yeah, yeah. So let's say a school counselor. It's dealing with a student, and there's various behavior patterns that aren't beneficial to the child in that environment. I just reframed there. Right, at the beginning, you said reframe, right?
Yeah.
So we have to really apply what we learned about mental health in young people, because language matters. I believe that wholeheartedly. Language matters. How can a counselor have a conversation with a parent about maybe we need to outsource your child's mental health? Maybe we need to get a doctor, a psychiatrist involved. What's an easy way that's really just laced in empathy that you can have that conversation? Because as a grown man, right, when my wife told me that I needed a therapist, I was very offended. It was true. So I don't, and I remember growing up when mental health was kind of mentioned, my mom was like, "Oh no, we're not doing that. You're tough, right? We're going to tough this out." So, and I'm sure the desire or the hesitancy to pursue mental health is at an all-time high now in certain communities. So how do school counselors, how can they have that conversation? What advice would you give them?
That's a good question. I think it starts with the school counselor having a relationship with whoever they would outsource to. This is where, again, that community is really important.
That's good.
Someone that they trust, a psychiatrist or outside therapist that they trust, and they can truly tell this family they trust them. I trust this person.
Yeah.
This is my friend.
Right.
They will help take care.
Yeah.
Help take care of the family, what we have going on. So I think that is the first step. And then again, going back to, I use the word normalizing mental health as health. And letting that family know, I know you guys are doing all that you can do. You are trying, you've done this, you've done that, validating that parent, validating their concern, validating that they're at a point where they need more help, because often the parents know too. And they just don't know where to go. And educating them, and just letting them know, hey, I want you to go talk to my friend, Dr. Yarberry. She specializes in this.
Yeah, she can help
with kids, and she can help.
Yeah. Okay, let's shift our conversation. I think therapy is in the midst here. Let's both be advocates for therapy, right, for the next 4 or 5 minutes. But first, how is therapy a part of what you do?
So I don't do formal therapy.
Right.
There are some psychiatrists who do. I do mainly evaluations and medication management, but I collaborate with my therapist. That's one of the requirements that I have, is that my patients are involved in therapy, because I believe in a collaborative approach.
Yeah, that's important. That collaborative approach is
very
key.
important.
Yes.
Medications treat biologically, but we have to also deal with the other aspects, the holistic, aspects of the child and the family. And that's the work we do in therapy. I will say I do what I call nuggets of therapy in my sessions. We talk about like CBT therapy, for example. We have thoughts. We can't control what thoughts come to our brains. I tell my patients this, you have, I call them stinky thoughts. They come to your brain, stinky thoughts. They come to your brain, and you can't control it. They just come. But those thoughts cause us to feel a certain way. We have certain emotions, and then that leads to some behaviors sometimes.
Yeah.
So I try to connect that. And so I do challenge that in my appointments with my patients. So I'm not doing a full CBT protocol, but I do those nuggets, and I help try to, emphasize and reiterate what they are doing in therapy.
Right.
That's why that collaboration between myself and the therapist is so important.
Yeah. No, I like that. And you saying that, it takes me to a place of, man, really using this movement to really inspire educators and youth serving organizations that education, that's the biggest thing. I keep hearing you say that. You can be the educator. You don't have to provide all the services. You don't have to solve the problem, but you can educate. You can connect people to resources. You can change the trajectory of a young person's life just by providing resources, just by teaching, right? And being and being aware and trauma informed.
Mhm.
It's only adding something to the backpack you're sending home every day anyway.
I agree. I think, again, you said being aware, being trauma informed, understanding the basic mental health diagnoses and when to seek help and where to seek help. I think those are basic things that all the teachers, all the school staff, and even our community programs really need to know about.
Yeah. Collaboration, you that's actually the next segment, and you mentioned it right during this conversation. You've given us some good tips on. You've motivated us. I think you've inspired the audience to really look into collaboration. Is there a model or something you've been a part of, or some research, right, that you've studied, where it kind of has a best practice around what collaboration looks like for providing the social emotional support that's so needed?
I can speak on my personal experience in regard to that. And I think, in my private practice, I mentioned earlier too, but I also, in addition to my private practice, I consult with some agencies in Arkansas that have like school-based programs. And I feel like that is I keep talking about school-based programs. They're so important because
Yes.
that's
No,
some
for
ways
sure.
they're the only way we can reach these kids and these families.
Yeah.
They're not going to come to my office. They're
That's
not going to
so
go to an
good.
outside therapy office.
Yeah.
And so that's the place, where this has to happen.
Yeah. I think at some point this movement, I think I'll take it to a place where we're going to schools, right, and we're helping to facilitate what those services could look like, because they just may not have the expertise. Some
Mhm.
districts just don't have the budget, right? But
True.
but there's still a way to embed, right, this type of support within the school. Sometimes you just need that outside perspective, right, with just a different expertise. Well, this has been a really great conversation. It's key takeaways, right? Education is key, right? For youth serving organizations and school districts to help support young people. Then it's emotional support. It's a form of prevention. We have to be aware what young people are up against, right? And the emotional deficit that we can send them into adulthood with if we're not doing everything that we can to support emotionally. And then it's something else that I think really hones in on some of your earlier conversation. It's when we see young people as humans, as whole people, we address them differently, right? And that's why I always use the term young people, right? It's because you treat a child a certain way, right? But like, no, that's a young person, right? From infancy to adulthood, it's a young person who needs to be like cared for, right? And who needs support. What's your closing statement?
I think the most important thing I want people to hear is that, children, adolescents, they need to be heard, they need to be seen, they need to be nurtured. And it's our responsibility, within the home, to the schools, to the community, to the churches. We have an opportunity to change the trajectory of these children's lives. And we can do this. We can work together as a community, and we can do this, and they're worth it.
Yeah, they are worth it. I don't think anything else can be said. Well, listen, that's a wrap on today's episode. Thank you so much for being here, for giving up the time out of your day to talk about this important issue. And until next time, I'll see you in a couple of weeks. And we're always giving young people the green light to be great.
More at longimpactgroup.com.